If you're turning 50 and you think castor oil is just something your grandmother used as a laxative, what I'm about to reveal will completely change your perspective. Because this ancient oil, used therapeutically for over 4,000 years, has specific benefits for male sexual function, prostate health, hormone balance, and overall vitality that most men have never heard about. Benefits so remarkable that when I started recommending it to patients, I was skeptical myself until I saw the results. I'm Dr. Madison Li, board-certified urologist with over 12 years of experience, and today I'm sharing something that sounds almost too simple to be effective. But the science is solid, the historical use is extensive, and the clinical results I've seen are undeniable. Castor oil, applied topically in specific ways, can improve erectile function, reduce prostate inflammation, enhance testosterone production, improve sleep quality, and boost overall energy in men over 50. This isn't about drinking castor oil, which I don't recommend except under medical supervision. This is about external application using a method that's been refined over thousands of years and is now being validated by modern research. A method so effective that men report noticeable improvements within days, and dramatic changes within weeks. But here's why this matters specifically at 50. This is when circulation starts declining, when inflammation becomes chronic, when hormone production drops, and when your body needs more support to function optimally. Castor oil works through multiple mechanisms simultaneously to address all these issues. It's not a miracle cure, but it's a powerful tool that most men are completely unaware of. Stay until the end because I'm giving you the complete protocol. The exact type of castor oil to use, the specific application methods for different goals, the timing that maximizes benefits, and the mistakes that make this completely ineffective. Let me start with a story that will make this real. His name was David. He came to see me at 52 years old with multiple complaints. His erectile function had declined over the past 2 years. Not completely gone, just less reliable and less firm. His energy was low, especially in the afternoons. He was having trouble sleeping through the night. His lower back had chronic stiffness. And he'd been experiencing mild urinary symptoms, getting up once or twice per night. We ran his labs. Testosterone was on the lower end of normal. Nothing critically wrong, just multiple systems functioning suboptimally. I could have prescribed medications for each symptom. Instead, I told him about castor oil packs. I explained the protocol and told him to try it consistently for 6 weeks before we considered medications. He looked at me like I was crazy. Castor oil? Like the old-time remedy? Yes, exactly like that. But used in a specific way that targets the exact issues you're experiencing. 6 weeks later, David came back and I could see the difference before he even spoke. His energy was visibly better. He told me his sleep had improved dramatically. He was sleeping through the night most nights. His lower back stiffness was gone. His urinary symptoms had reduced significantly. And his erectile function had noticeably improved. Firmer erections, more spontaneous arousal, better overall sexual response. He said, "I can't believe something this simple and inexpensive made this much difference. Why isn't every doctor talking about this?" That's exactly what I'm doing today. So let me explain what castor oil actually is and why it has these remarkable effects. Castor oil is extracted from the seeds of the Ricinus communis plant. It's been used medicinally in ancient Egypt, India, China, and Greece for thousands of years. The primary active compound is ricinoleic acid, a unique fatty acid found almost nowhere else in nature. Ricinoleic acid has several powerful properties. First, it's intensely anti-inflammatory. When absorbed through the skin, it reduces inflammatory cytokines, the chemical messengers that promote inflammation throughout your body. Chronic inflammation is one of the primary drivers of aging, prostate enlargement, vascular damage, and declining sexual function. Reducing systemic inflammation improves function across multiple systems. Second, ricinoleic acid improves lymphatic circulation. Your lymphatic system is responsible for clearing metabolic waste, toxins, and inflammatory compounds from your tissues. After 50, lymphatic function naturally declines. Stagnant lymph leads to tissue congestion, inflammation, and poor cellular function. Castor oil stimulates lymphatic flow, clearing waste and reducing swelling. Third, castor oil increases blood flow to the area where it's applied. Better circulation means more oxygen and nutrients delivered to tissues, better waste removal, and improved cellular function. For sexual organs, better circulation directly translates to better erectile function. For the prostate, better circulation reduces congestion and inflammation. Fourth, castor oil has been shown to support hormone production, particularly when applied over the liver and lower abdomen. The liver is where many hormones are metabolized and regulated. Supporting liver function supports overall hormonal balance, including testosterone. Fifth, castor oil has a profound effect on the parasympathetic nervous system. When you apply castor oil and rest with it on your body, it activates the rest and digest response. This reduces cortisol, improves sleep quality, and allows your body to shift from chronic stress mode into repair and regeneration mode. Now let me teach you the specific protocols for different goals. There are several ways to use castor oil, each targeting different aspects of male health. Protocol 1. The pelvic pack for prostate health and sexual function. This is the most important protocol for men over 50. It directly targets the prostate, bladder, and sexual organs. You'll need high-quality, organic, cold-pressed, hexane-free castor oil. A piece of wool or cotton flannel fabric, about 12 by 12 inches. An old towel you don't mind getting oil on. A heating pad or hot water bottle. And plastic wrap or an old t-shirt to contain the oil. Here's how to do it. Fold the flannel into 3 or 4 layers. Saturate it with castor oil. Not dripping wet, but thoroughly soaked. Lie down on your back. Place the saturated flannel over your lower abdomen, covering the area from your pubic bone up to your navel. Cover the flannel with plastic wrap to prevent oil from getting everywhere. Place the heating pad or hot water bottle on top, set to medium heat. Cover everything with the towel for insulation. Lie there for 45 to 60 minutes. This is not time to watch TV or scroll your phone. This is rest time. Close your eyes. Breathe deeply. Let your body relax completely. The combination of the oil, the heat, and the rest activates profound healing responses. Do this 3 to 4 times per week. The best time is evening, 1 to 2 hours before bed. Many men fall asleep during the pack, which is fine. The deep relaxation and parasympathetic activation improve sleep quality dramatically. What you'll notice, within the first week, most men report better sleep and reduced nighttime urination. By week 2 to 3, prostate symptoms like weak stream or urgency often improve. By week 4 to 6, many men notice improved erectile function and increased libido. The effects compound over time. Protocol 2. The liver pack for hormone balance and detoxification. Your liver is crucial for metabolizing hormones, clearing toxins, and maintaining overall health. After 50, supporting liver function supports everything else. Use the same setup as the pelvic pack, but place the castor oil flannel over your right side, covering your liver area. This is the right upper abdomen, just below your rib cage. Do this 2 to 3 times per week, alternating with the pelvic pack or on separate days. Liver packs improve hormone metabolism, reduce estrogen dominance, support testosterone balance, enhance energy levels, and improve digestion. Many men report feeling clearer mentally and more energetic after consistent liver packs. Protocol 3. The lower back pack for circulation and vitality. Poor circulation in the lower back and pelvic region contributes to erectile dysfunction, prostate congestion, and low energy. This pack improves blood flow to the entire pelvic area. Place the castor oil pack over your lower back, covering the kidney area and sacrum. Use the same method, heat, rest, 45 to 60 minutes. Do this once or twice per week in addition to the other protocols. This pack is particularly effective for men with chronic lower back stiffness or pain. The combination of anti-inflammatory effects, improved circulation, and muscle relaxation often eliminates pain that's been present for years. Protocol 4. Castor oil massage for direct erectile support. This is more targeted and can be done more frequently. Take a small amount of castor oil, about a teaspoon, and massage it into the skin of your lower abdomen and inner thighs. Use gentle circular motions, massaging for 5 to 10 minutes. The massage improves local circulation, the oil absorbs and reduces inflammation, and the physical touch activates nerve pathways that support sexual function. Do this daily, ideally in the evening. Many men incorporate this into foreplay with their partner, which adds a relational element to the therapeutic practice. Now let me tell you what to expect with consistent use and address common questions. Timeline of benefits: days 1 to 7, improved sleep quality and reduced nighttime urination are usually the first things men notice. The deep relaxation from the packs improves parasympathetic tone, which enhances sleep. Week 2 to 3, prostate symptoms like urgency, weak stream, or incomplete emptying often improve. Inflammation reduces, congestion clears, function improves. Week 4 to 6, erectile function improvements become noticeable. Firmer erections, more spontaneous arousal, better overall sexual response. Week 8 to 12, energy levels, mood, and overall vitality improve significantly. Many men report feeling like they've reversed several years of aging. Question 1. Is castor oil safe? Yes, when used externally. It's been used for thousands of years with an excellent safety profile. Some people have skin sensitivity, so test a small area first. If you develop a rash, dilute the oil with coconut oil or discontinue use. Do not take castor oil internally without medical supervision as it's a powerful laxative. Question 2. What type of castor oil should I use? Only use high-quality, organic, cold-pressed, hexane-free castor oil. Hexane is a chemical solvent sometimes used in extraction that you don't want absorbed through your skin. The most reputable brand is Heritage Store, though there are other good options. Do not use cheap, low-quality castor oil. It's not as effective. Question 3. How often should I do the packs? Start with 3 times per week for the pelvic pack. You can add liver packs on alternate days. More is not necessarily better. Your body needs time to process and respond. Consistency matters more than frequency. Question 4. Can I do this if I'm on medications? Almost certainly yes, but check with your doctor if you have specific concerns. Castor oil applied externally has minimal systemic absorption and doesn't interfere with most medications. However, if you're on blood thinners or have specific medical conditions, always consult your healthcare provider first. Question 5. How long do I need to continue this? Think of it as ongoing maintenance, like exercise or healthy eating. You'll notice benefits within weeks, but the effects are sustained only as long as you continue the practice. Many men do intensive packs for 3 months, then reduce to once or twice weekly for maintenance. Question 6. Will this replace my medications? It depends. For some men with mild symptoms, castor oil packs alone provide sufficient improvement. For others with more significant issues, the packs work synergistically with medications, often allowing for dose reduction. Never stop prescribed medications without your doctor's approval. Let me share another patient story. Richard, 56 years old. He'd been on Flomax for BPH for 2 years. It helped but didn't eliminate his symptoms. He still got up twice per night, had urgency during the day, and felt incomplete emptying. I suggested adding castor oil packs to his regimen. 3 times per week, pelvic packs with heat and rest. 2 months later, his nighttime urination dropped to once or not at all. His daytime urgency nearly disappeared. His stream was stronger. We gradually reduced his Flomax dose with his symptoms remaining controlled. Eventually he stopped the medication entirely and maintained his improvement with castor oil packs twice weekly plus dietary changes. He told me, "I never thought something this simple would let me get off medication. I feel better now than I did on the drug." Now let me give you some advanced tips and complementary practices that amplify the benefits. Advanced tip 1. Add essential oils to your castor oil. Lavender oil promotes relaxation and enhances the parasympathetic response. Frankincense oil supports cellular health and has anti-inflammatory properties. Peppermint oil improves circulation. Add 2 to 3 drops of essential oil per tablespoon of castor oil. Advanced tip 2. Practice deep breathing during the pack. Inhale for 4 counts, hold for 4 counts, exhale for 6 counts. This breathing pattern maximizes parasympathetic activation and enhances the benefits of the pack. Advanced tip 3. Combine castor oil packs with other prostate supportive practices. Take saw palmetto or pygeum supplements. Eat a prostate-healthy diet rich in tomatoes, cruciferous vegetables, and pomegranate. Do daily pelvic floor exercises. The combination is more powerful than any single intervention. Advanced tip 4. Use the packs before important intimate occasions. If you know you'll be sexually active in the evening, do a pelvic pack in the afternoon. The improved circulation and relaxation enhance sexual response that same day. Advanced tip 5. Track your progress. Note your urinary symptoms, erectile quality, energy levels, and sleep quality before starting. Reassess every 2 weeks. You'll see measurable improvements that motivate continued practice. Now let me address some misconceptions and concerns I hear frequently. Misconception 1. Castor oil is just an old wives' tale with no science. Wrong. There are numerous studies on ricinoleic acid's anti-inflammatory properties, lymphatic effects, and circulatory benefits. While research specifically on sexual function is limited, the mechanisms are well established and the clinical results are consistent. Misconception 2. If it were really effective, doctors would recommend it. Most modern doctors are trained in pharmaceuticals, not traditional remedies. Medical education has almost no coverage of natural or traditional therapies. The lack of recommendation doesn't mean lack of efficacy. It means lack of awareness and lack of profit motive since castor oil can't be patented. Misconception 3. The benefits are just placebo. The improvements I see are too consistent and too measurable to be placebo. PSA levels drop. Urinary flow rates improve. Hormone levels change. Sleep quality measured by tracking devices improves. These are objective changes, not just subjective feelings. Misconception 4. It's messy and inconvenient, so it's not worth it. Yes, it requires some setup and dedicated time. But 45 minutes 3 times per week is a tiny investment for the benefits received. And the mess is minimal if you use plastic wrap and old towels. The inconvenience argument is really an excuse for not prioritizing your health. Here's what I want you to understand. Modern medicine excels at acute care and emergency treatment. But it often fails at supporting the body's natural healing and maintaining optimal function, especially as we age. Traditional remedies like castor oil packs fill that gap. They support your body's innate ability to heal, reduce inflammation, improve circulation, and maintain function. You're not choosing between modern medicine and traditional remedies. You're integrating both. Use medications when needed. Use natural supportive therapies to enhance function and potentially reduce medication needs. This integrated approach gives you the best of both worlds. Your sexual function, prostate health, energy levels, and overall vitality at 60 and 70 are being determined by what you do consistently in your 50s. Castor oil packs are one of the most powerful, accessible, and affordable tools available. The question is whether you're willing to invest 45 minutes 3 times per week into your long-term health. Here's my challenge to you. Get high-quality castor oil and the supplies you need this week. Start with pelvic packs 3 times per week for 8 weeks. Track your urinary symptoms, erectile function, sleep quality, and energy levels. Be consistent. Give it a real chance. After 8 weeks, assess your results. Then come back and leave a comment. Tell other men what you experienced. Your testimony could convince someone else to try this and potentially change their life. If this video introduced you to a practice that could improve multiple aspects of your health simultaneously, hit that like button. Share this with men over 50 who are dealing with prostate issues, sexual dysfunction, or just want to optimize their vitality. Subscribe to this channel for integrative approaches to men's health that combine modern medicine with time-tested traditional practices. I give you the full picture, not just pharmaceuticals. Turn on notifications so you never miss content that could add years of quality life to your later decades. Comment below and tell me, have you ever used castor oil therapeutically? And are you willing to commit to 8 weeks of consistent castor oil packs to see if the benefits are real? Share this video with any man approaching or past 50. This could be the missing piece in their health optimization that they never knew existed. Remember, this is educational content based on historical use, physiological mechanisms, and clinical observation. It doesn't replace individualized medical advice. Work with healthcare providers who understand both conventional and integrative approaches. I'm Dr. Madison Li, and I'll leave you with this. Sometimes the most powerful solutions are the simplest. Sometimes ancient wisdom offers benefits that modern medicine has forgotten or overlooked. Castor oil has been used for over 4,000 years for good reason. It works. Your prostate health, sexual function, and overall vitality don't have to decline as you age. With the right tools, practices, and consistency, you can maintain and even improve function well into your later years. Your pack is waiting. Your improved health is waiting. Starting this week. See you in the next video.